This conference will now be recorded.
All right, guys. So welcome to IENCAP OSCE information session. And this information session is not only limited to IENCAP OSCE, but it will also talk about ARNAP, which is a different name given to an exam for the Albertans and for the people who are challenging the exam in Ontario. They call it IENCAP OSCE. So my name is Harpreet, and as I just told you about me, so I own this review and counseling place called PS Learning. And so we are two people who are involved in this. It's me, Harpreet, and my husband, Suk, who is also an RN. And those of you who know us can actually understand that we are constantly working towards improving and kind of like bringing out quality content for the nurses who wants to come back to their practice in Canada. And if you can see the screen, then to just let me know, okay? These few slides are just for fun. Yeah. Okay. All right. So now let's, I won't talk a lot about us, but I would just dig straight into the topic for which you guys signed up. So let's talk about IENCAP OSCE. So it's a competency exam. Canadians are very strict about assessing us whether we are competent enough that today I wrote my NCLEX and am I eligible to go and work in the hospitals of Canada tomorrow? So they will not leave this until NCLEX. They would check me way before that, and based on whatever they're able to assess, they would ask me to study those gaps and from the system. And so this is a competency assessment exam where we who are internationally educated nurses, internationally educated graduates, were tested on Canadian benchmarks. And if you've been to Touchstone website, you would have noticed that they have assessments for a lot of professions. Like there will be physios going for the similar assessment, dietitians, physicians, and everyone. So nurses are one of those many professionals which they're testing, who they're testing. And it is a two-part exam, and it is going to be very exhausting for you guys when you go for this, because you do everything in one day, unlike the assessment which happens in British Columbia, which is called NCAS assessment. It is a 2 different days exam. You guys do the written part one day, and then you go back for the practicum. But for OSCE, it's 1 day exam. The same day you're going to do your written as well as your practical exam. And what is the format? This thing I'm sure you must have looked up on the website, because this is like written on the first page. So you have a written exam, which is multiple choice questions. There will be around 97 questions, and you have 2.5 hours to do them. And according to me, like whatever I have experienced, 2.5 hours is a very good amount of time to do all these 97 questions. And then all these questions have the same format, where they're like 4 options, and you have to pick up either the best option or the correct option. So this is where a lot of things come, that every option is correct sometimes, and then they ask you what is the best thing the nurse can do, or they may ask you what is the first thing the nurse may do. So that's where a lot of people get confused, because a lot of the students would tell me that we are able to eliminate 2 wrong options, and we are also able to kind of like we are able to figure out, okay, these 2 are the correct answers, and then the final, like which is which one. So for that, we need to kind of like know the system and dig deep into like how the Canadians work, and also have to have the basic knowledge of nursing practice in Canada. Then comes your OSCE, which is the objective structured competency examination. This is your practicum part. And in this part, they give you 12 different types of case scenarios, which they refer to as stations, and you have 13 minutes for every single station. So you go in, you do your stuff, which we're going to talk in later slides, that how you proceed. So you have 12 case scenarios and 13 minutes each for digging up into each of these scenarios. So this is an overview of how your exam is going to look like when you go. All right, the big question, how to prepare for this exam, because it is so funny about Canadian examinations. That's what, like, I have personally found that, oh, we're going to test you, but we're not going to let you know that how to study for it, where to study from it. Unlike IELTS and NCLEX, there's like huge amount of content on the web. You can just Google NCLEX and you'll get like question after question, but that's not the case scenario with OSCEs and with exams like CPNRE, with SALBIN. So it's very important to understand like how this exam works in order to know what to study. So that's what we're going to talk more about in this webinar, because I know you all are interested to know that. All right, first things first. So my first question to you all, which I would like to hear from you, or you can, and I want you to like type in your chat boxes or wherever you want. What do you think are they assessing you on? What are the assessment tools, or what are the things they want to know in you as nurses that you get no gaps? So tell me, take your time. Tell me what are they assessing you on? I want you to start typing. This is the only part of the live interactive webinar, right? And I'm taking a little water break here. Yes, so we have competency gaps. Andrew is saying we have competency gaps. Balwinder is saying our skills and knowledge. Yes, someone else, maybe this is Pravina, practical knowledge, our nursing skills. Yes, that's what is a very standard expected answer, that our knowledge, our practical skills, these are the things which they are testing us on. And as Andrew said, your competency gaps, he's very much close to it. So they're basically assessing us on something which is called as entry-level practice expectations. So they are not testing you if you were an OR nurse in your home country. They don't care if you were a labor and delivery nurse in your home country. At this point, they're going to make you a registered nurse who is eligible to work as an entry-level nurse in a hospital. So that's where a big challenge like comes for us as internationally educated graduates, because what we do is we just focus on our knowledge and our skills. And can you imagine how much is their weightage in the exam? 40%. So 20% your knowledge, 20% your skill, and rest of the 60% is something which you guys can't even imagine, that, oh my God, like I have to keep in mind these things as well. And that's where we go wrong. We do not study the exam. We do not study for the exam the way the exam is being assessed, the way they're kind of like, they want us to prepare. So that's where the trick comes. So first of all, I want you all to know what is or who is an entry-level nurse, and that will actually clarify a lot of your doubts. Now, who would have imagined that Harpreet is going to make us read a definition and then would explain a definition, right, in the wildest dreams? But this is what is going to crack a lot of your answers for which you signed up today. So entry-level registered nurses are those who are prepared at university level as generalist. So this is your first thing. We are going to be generalist, guys. We are not going to be specialist nurses. So this is where comes a huge difference, that what you need to study and what you don't have to study. So you just have to study basics of everything, and majority of your test is med-surg. So you're generalist. Now to exemplify this, I work in Emerge, so I could give you a scenario from Emerge. So in Emerge, when nurses are hired, they are not emergency trained or emergency or ER trained nurses. At that time, they are entry-level nurses. And entry-level nurses are generally hired on the floors like medicine, surgical, or in the public health, or even in the Emerge. When they're hired as med-surg nurses, because that's the generalization. And when they study further, then they become specialists. So you are going to be a generalist at the entry-level nurse. So this actually clarifies a lot of your questions, what you need to study, the general overview of nursing. Why? To enter into practice, and these three things are also equally important for the exam, safely. So you need to practice safely. Now, what is safe practice? Safe practice is, are you meeting all the infection control? Are you keeping yourself and your client safe enough that you're not catching any infection, your client is not catching any infection? Are you able to prevent any complicated scenarios like fall? Do you know how to prevent a fall? Do you know how to prevent complication of immobility? All those are safe practice. And I know all of you freak out with safe practice because Ontario, like CNO, oh, my safe practice period expired. Yeah, safe practice is always important. So this is what safe practice is. Okay, so then competently. So your competence is another thing which is so important. Now, competence is more about your skills, how skillful you are as a nurse. Are you able to do your IVs with the sterile techniques? Are you able to give all the medications when you're well aware what to assess? For example, you should know that I'm going in to give digoxin to this patient. Before I enter the room of this patient, I should be aware what is the potassium level of this patient, and there's a whole reason behind this. I should know what is the digoxin level in the serum of this patient, because I don't want them to have digoxin toxicity. And when I go in, before I give the med, after I did all my 3 checks, 7 rides, am I able to check the apical pulse? That's my competency. If the apical pulse is low, below 60, am I aware that I have to withhold this medication? So this is what is your knowledge, and then how you apply your knowledge into your practice. So that's what they're testing you on, not just that you read somewhere this and that. Yeah. And then the last thing is ethically. And ethics is a very, very vague term, and there's so much they so much consider ethics when it comes to nursing in Canada, because if you're not a truthful person, if you're not honest to your job responsibilities, then definitely there is a trouble in your practice. Definitely there is a trouble in your perspective. So ethics doesn't only mean that you have to be truthful or liable or whatever. It's more than that. It's how you respect a person as an individual, how you respect them on the basis of their gender preference. Are you judgmental? Do you pass on any judgmental comments? And also how you communicate with a patient in various patient scenarios, because on your OSCEs, they give you challenging scenarios. Like you may come across a mother of a teenager who just got pregnant, and now you're asked to communicate with that mother and tell her about what happened with the girl. So that kind of case scenario happens, then definitely your ethics, your communication are more important. In that scenario, you can't really show how competent you are as a nurse, because you don't have to give any injections, and all our knowledge is, okay, oh my God, will they ask me to give IV? That's kind of like the frequently asked question. Like for me, that's the most common question I hear, that how many IVs do I have to do? You may have not to do like any IVs, but this is what they're testing you on. Yeah, so this is entry-level nursing, and this is what we will focus on during the rest of the things as well. Then comes what kind of scenarios and what kind of patient population. So there are 4 W's of an entry-level registered nurse, like when does she practice, whom does she give care, where does she give care, and who all are part of her nursing practice. So a registered nurse has to practice or has to give care in all situations, whether it's health or illness, which indicates that you're going to get questions even for health promotion and prevention of illness. So as you know, that Canadian healthcare system is more of a preventative healthcare system. It's not, we do not wait till the disease happens. We try to prevent it as much as possible. So that's what may be on your multiple choice questions. That may be on your OSCEs, that you have to give teachings to someone, you have to encourage someone to get immunized and they're not getting immunized. So that may be a scenario you have to deal with. Then in situations of their illness, when they're sick, how do you deal with them? So now, of course, I know and I'm 100% sure that you all are well aware how to take care of sick patients. You've been nurses, you've been awesome nurses in your countries, and you will bring that compassion, that competence forward here as well. And then who are your population? It could be all genders, and across the lifespan, you may have to deal with infants, you may have to deal with pediatrics, teenagers, with juvenile patients, with adults, with the elderly, geriatric patients. So it's like all across the lifespan, you will be looking after the patients. And where? In all areas of practice setting. So in Canadian healthcare system, we have various practice setting areas. So first of all, we have acute care and then long-term. So acute care is your hospitalizations, include your ER, then your medicine floors, your surgical floors, and definitely your long-term is a lot of you may be working as HCAs or LPNs at this point of time, and long-term is where the old age people live, and we look after them 24/7, and it's not basically to treat them, but to give them a good quality of life. So it's more like palliative. So you will have questions on palliative care versus acute care as well. Then who all are you going to deal with? You're going to deal with client, who's your patient. You're going to deal with them as an individual, and then you may have to deal with client plus family as a group, then communities and populations. So this is all where a registered nurse has to function. And on your OSCE, there are a lot of questions on how to talk with families, and then of course about community as well, because it's all about Canadian healthcare system beyond your imagination. Yeah. Now, how will we meet these competencies, and what are the competencies? You know, we always know, oh, they gave me competencies to meet, or they said you have a competency gap. So these are the 5 competencies on which they assess you. And so if you go through the participant guide of IENCAP OSCE, if you've already read that word to word, page to page, I'm so proud of you. But if you haven't, I would definitely want you to have a look on it, because that will exactly tell you kind of like what to study. It's hidden. There's a tricky part, but now you will know it. So we have so many competencies to meet. And as you can see in this diagram, this is from the CNO conceptual framework for organizing the competencies of an entry-level registered nurse. So from here, you will know that your client is always your focus. So I want all of you to write down like one thing on your notebook. One important thing which you take from this class is, whenever you're in any OSCE scenario, your care has to be client-centered. Do not worry about your tasks. That's what I always tell people in my OSCE classes, because a lot of us, the thing is, you see that sheet, oh my God, I have to do the assessment in 7 minutes, and they give you a 6-minute warning, like wrapping it up. Do not worrying about, like, you're not worrying about how my patient will feel if this was a real life scenario, because you're running, you're chasing time. Time management is really important, but if your client was having any other issue while you're trying to do the thing which is written for you, it's okay. That was a trick. You were trapped when you were trying to chase time. So keep in mind when you're prepping for your OSCE, your care has to be client centered. Never ever orient your care around your task. So these are the competencies you will be doing. So we have professional responsibility and accountability. This competency is tested in your MCQs or your written part. So you can imagine like what kind of questions there will be. And there is also an example given on your IENCAP blueprint or the participant guide. So those questions revolve around professional responsibility and accountability. Then we have service to public. This is the second domain on which is tested in your MCQs. And then the third domain or the third competency or the third set of competencies which they're checking you in the MCQs is self-regulation. So now you can imagine what kind of questions are you going to get for MCQs. You don't have to like study Saunders page to page, cover to cover, because you were going for this one. So professional accountability, responsibility, self-regulation, and service to public are the types of competencies for the written part of the exam. And ta-da, we have knowledge-based practice and ethical practice for the OSCE. Problem solved. Yeah, I want all of you to smile. Okay, so now again, a very big question. Oh my God, like what are these competencies? Are you kidding us? How can we meet them? And trust me, like if I was on the other side, I would be like looking at the competencies and really, what do I learn from this? Do I have to like memorize this and all that? And when I started teaching OSCE, so I was on the other side, like the giving end, and I started reading competencies, and they were actually making sense to me. So that's how I can very well assure you that if you know your competencies, you cannot go wrong on this exam. You know the basics of nursing. I know that if I ask you to study anything, you all can memorize that. That's how we have always studied. But understanding that competencies, that Canadian healthcare system is something which is going to help you crack this exam really easily. So let's see, how do we meet the competencies? So for the professional responsibility, we have, we have a student who's asking what time the meeting starts. I'm not sure if she's in the class. Let me just check. I'm so sorry about that. No. Okay, sorry about that. So yeah, so the first set of competencies which you need to work on are the professional responsibility and accountability. Now, these are the competencies which actually show them that how are you going to deal with situations like if your coworker is not cooperative, or there is a conflict, like how will you resolve the conflict? That's one of the things they test you on. Then it could be how much do you for accountability, like how much are you able to bear it on your own, that yes, it's my fault, I have to report this, or I have to tell this to the registered nurse if, or my senior, that I'm not able to give the right drug, or I did this mistake and stuff. So how much are you able to accept your own actions? So when you get such MCQs, you always look at this competency, keep this competency in mind, and then you pick up the correct answer. That am I meeting professional responsibility in this one if it is dealing with such things? Then it also tests if you're aware of the scope of practice. Do you know that as a registered nurse, are you able to do certain tasks and you're not able to do the other tasks? And for this one, registered nurses are very autonomous. Like, we are one of the very autonomous professions in nursing, or in the healthcare. So we can take a lot of actions without the doctor's orders. It's just about medicating and consent and stuff. But to a very greater extent, we are autonomous. So I would recommend you to go to CNO's website and CARNA's website and read the practice standards, which would tell you the scope of practice of registered nurses. And another little tip for solving your MCQs is you never pass on your responsibility when you are a registered nurse. You always want to do things by yourself. You only pass on if you know this is beyond your scope of practice. For example, if you had a COPD gentleman and he was having shortness of breath, you just entered the room, he's lying flat in bed, he has his oxygen on. So what do you do first? Definitely, you're going to do the assessment and check this, get a set of vital signs to get their saturation of oxygen. You're going to give them a high Fowler's position so that their thoracic cavity is bigger now, larger, and they're able to breathe properly. And then you're going to check the oxygen, whether they're getting it, there is any kinks or any tubing is okay or not. And once you figured everything out, you think that your patient is stable, but they're still not stable. Their SpO2 is still pretty low. And now, what do? Now is the time that you pass on your responsibility or you seek guidance. I'm seeing a few of your typing. Yes, perfect. You inform. So this is the right time when you inform, and this is what they're testing you when they're asking you this question. They're testing your professional responsibility. That, are you aware when can you seek help, or when should you seek help? So that's how your questions will be. Then we always look for collaborative practice, which is also part of professional responsibility. Are you aware of who are the members of your healthcare team? What kind of roles and behaviors do they have to perform in the hospital setting or in other settings? For example, if you're sending your patient home and they need home care, you know that the referral has to be sent to home health care. You have a patient who has issues with their diet, you know that a registered dietitian has to be involved. So are you aware of all these things? That's another role, or that's another criterion which has to be met under professional responsibility. And definitely, when you're answering any of these questions, your critical thinking, your critical inquiry, they are always under the testing situations. Then are you having that evidence-based things? How safe is your practice? Are you able to keep yourself, your colleagues, and your patients safe? So these kind of things are the type of questions which you will see. And other than that, another thing which I would definitely recommend you studying is delegation. As registered nurses, you have LPNs working for you, you have PSWs working for you. So there may be some questions where they may ask you, what kind of task are you going to delegate to an LPN, to a PSW? So know a little bit about delegation, and then definitely your time management, your punctuality, your discipline, your professional judgment, all these play a very important role in this meeting this competency. I hope I have made it very clear. So these are the types of multiple choice questions you're going to see on your exam. Then the next competency is, this is my favorite because this is everyone's favorite. Like this is the only competency I would think about when if I were preparing for the exam without knowing anything else. So I would definitely go over this. Now, your knowledge-based practice is being tested, but it is not tested on your MCQs as much as it is tested on your OSCEs. So in OSCE scenarios, they are definitely going to see how are you able to, how much knowledgeable you are, and how competently you're able to apply that body of knowledge into your practice. That's what they're looking at. They want to know if you know your basic nursing things. Are you aware that what can be the complications if somebody has a COPD exacerbation, or what is the complication if you run NS1 at 175 to a CHF patient? Are you aware of that? And are you aware that what will be the complications if somebody's potassium is already low and you're giving them Lasix? So these are the basic things they want to test you. And then they also want to see that are you able to apply this in your knowledge? For example, if you're going to give some medications, are you aware what lab values do you have to test? If you have to do some certain kind of assessments, what are the things you're going to do in assessment? And your assessments is like, that's another thing, a lot of like frequently asked question, like what is assessment? So on the exam and in the real nursing world, there will be very less opportunity when you will be doing a head to toe assessment. Every time it's like focused assessment. So you should be well aware of how to assess someone's cardiovascular system, someone's respiratory system, then a little bit about their peripheral pulses, their ortho system and all that. So make sure you know all the basics of assessment. That's what they're going to test you here, like this, your specialized body of knowledge and your competent application of knowledge. So it's all your OSCE thing, right? And talking more about this application of knowledge. So under application of knowledge, they want you to be very perfect as nurses. And if you are a perfect nurse and your patient starts having chest pain, what do you do first in the ideal scenario? Write it down in the comments so that I can sip a water. What do you do if you're a perfect nurse and your patient starts having chest pain? What's the first action you take? You freak out, that's the first action. You panic, you shout, yell, chest pain, chest pain. So if you are a good nurse and it's a book scenario, like if it's a real world scenario, I have no idea, like what are you going to do? Someone's typing, so I'll wait for some answer. Can properly make the client calm, okay. Andrew said something. Okay, Balvinder is like administer oxygen, okay. Andrew, what properly? If client can breathe properly, what do you want to do? Maybe assessment? Yeah. Okay, so administer oxygen. Yes, yes. So that's very standard answer. If my patient is having chest pain, I would just administer oxygen. Wrong answer. You are a nurse, so everything is nursing process. Now you know your answer. You assess them first. You figure out what's going on. What kind of pain is this? Where is this pain? And how long have you been having this pain? Yes, Divya, you assess them. And yeah, so check it out first. So this is another thing they're assessing you on, your competent application of knowledge, guys. This is what OSCE is all about. You freak out, or you take a deep breath, and before you calm down your patient, are you calm enough to do that? That's what they're testing you on. So always remember, keep in mind your nursing process. You want to assess first, then you want to do some planning. What are you going to do? Then you do the intervention. And of course, if you're doing the intervention, you're always documenting, because if you did not document, you technically did not do it. So make sure you learn how to document. That's immensely important for OSCE. Yeah. And everywhere you deal with all this, you always use your critical thinking as much as possible. And critical thinking, I always say, is nothing but your common sense. So use your common sense, use the ability, the intuition that what I would do if this ever happens in the real life, I would always assess. So don't think about freaking out, because I know most of you will, but I would do that too. So I recently had an incident where my mom she passed out. So this happens in the emergency like every day, and I know how to deal with it. But when it happened in front of me to my mother, I know it was different. I was just panicking and freaking out. Yeah, but anyways, so just assessment is always your first thing, right? And now remember, this is your OSCE. This is not your MCQ, knowledge-based practice. Okay, then is ethical practice. This is again part of your OSCE. It's not part of your MCQs, so you may barely see any questions on your written exam where they're going to test you on ethics and stuff. They will see that how honest, how respectful you are. So a lot of the times, just talking to the patient, knocking at the door, maintaining confidentiality, maintaining privacy. The moment you pulled that curtain, you actually won the hearts for your ethical practice. Then again, safe environment, and of course, are you able to introduce anyone properly? Do you have any issues with telling them who you are, and how do you explain the procedure? Because if you do not explain the procedure, and you're just doing it, definitely you are disrespecting your patient, and that is very unethical. And always taking a consent, always having a verbal consent is one of the most important ethical responsibilities which you're going to show. So when you go for your OSCE, make it a point to knock at the door, make it a point to maintain privacy, wash hands, because that's your safe practice. Introduce yourself. Hi, my name is Harpreet. I'm your nurse for today, because that's one thing. It covers your professional responsibility, and the other thing is it's ethically important. And you're always taking an informed consent from your patient. So all these things, they cover your ethical practice. And if you're doing it consistently, scenario by scenario, scenario after scenario, I have no doubt that something wrong will happen. Yeah. Okay, so this is ethical practice, problem solved. Service to public is another one. Now, this one is tested on your MCQs. This is not an OSCE thing. So service to public is all about how you improve public health. And here you will be asked to collaborate with other healthcare team members. You will be asked to collaborate with policy makers at agency level, at national level. So for example, there's one of the questions I was thinking, there is a question on your participant guide. Just excuse me, we have a person, Melodine, who was supposed to join, but due to some reason, she's not able to.
This conference will now be recorded.
Yes, thank you. So so you will be yes, so it's your public health scenario. So you will be asked to talk about community settings, and majorly here you're talking about a healthcare team and you should know all the preventative measures you want to take. So I was thinking about this question from your participant guide, which I'm just going to quickly pull out, which brings me to this same scenario. So there's one of the questions on a registered nurse disagrees with the social worker's discharge plan for a client. So what should the registered nurse do? Now, she doesn't want the client to go home, but the social worker wants them to go home. So what is the best way to deal with this situation? So in this situation, you're advocating for your patient, which is your service to the public, and also you are kind of like collaborating with another healthcare team personnel. So definitely there is a conflict in the thought process, so you want to resolve that. So the best answer which anyone would pick up from here, you can definitely go and read this question, you'll understand which question am I talking about. So you'll see that the best option will be to integrate, they say partner with the social worker to integrate individual views into discharge plans, so that they could figure out that what is the nurse thinking, what is the social worker thinking, and what is the best thing they both, or conclusion they both can come to, so that they could think the best about their clients. This is one of the service to public examples. So and this will be only in your multiple choice questions. Just a good thing to know, right? Then moving ahead, the next competency you will be needing is self-regulation. Now, self-regulation is all about yourself, that how are you able to know yourself. It's mainly about your introspection, that are you aware that you may need some continuing education on this? Are you able to reflect upon your knowledge, about your skill, on your practice? So again, this thing is going to be tested on your multiple choice questions. And here, again, another thing which they have written in that competency is that are you able to implement and evaluate some learning plans for yourself? So now you know what kind of answers you want to pick up, where you're growing as a person, you're growing as a professional. So this is another competency which you will be meeting through your multiple choice questions only, right? So with this, we're done with all our competencies. So what were the competencies, and how do we meet those competencies? And these and with this, we also just kind of discussed what kind of questions are you going to encounter in your written exam. So let's talk about your OSCE a little bit. So your OSCE, which is your practicum exam, is going to be 12 stations, 13 minutes per station. And as I mentioned earlier, you're being assessed based on two competencies, which is your knowledge-based and your ethical practice. So when you appear for this exam, you have to really be careful about what are they asking you, how can I apply my assessment skills here, how can I apply my skills for knowing sterile technique, safety into this scenario. So that's what you will be always looking for. How to proceed? So definitely there are parts of this OSCE exam. Your 13 minutes are divided into 3 time categories: 2, 7, and 4. The first thing you do is you will get some instructions to do, and you have 2 minutes of reading time. Then there will be a client encounter, which is your actual scenario, and you have all 12 stations with standardized patients. So there is technically nothing which is on a mannequin, unlike again NCAS where they may have some scenarios with a high fidelity or a medium fidelity mannequin and the other ones with standardized actors. Here, all the scenarios are with the real people, human standardized actors, and you have 7 minutes to perform that whole scenario. And then the last thing is kind of a viva, where the examiner asks you 4 questions for about 4 minutes, exactly on that case which you just presented before them. Now let's see how to go at each step, how they've divided each step. So there will be an instruction sheet, which I'm going to show in the next slide. And you have 2 minutes of reading time for going over that instruction sheet. And that instruction sheet will have your client's name, their age, where is this scenario located? Sometimes the scenario will be in the doctor's office. The other times the scenario will be in the home setting. The other times it could be in the acute care, like it could be emergency room, or it could be a post-operative anesthesia unit, anything. And then the last thing they mention is the task assigned to the candidate. So they exactly tell you, okay, when you go in, you got to do assessment. When you go in, you got to do counseling. When you go in, you got to give discharge instructions. So they'll tell you exactly what you have to do. And the OSCE scenario sheet looks like this. So this is the sheet which you will see sticking on the door of your room into which you're entering. So for example, in this sheet, let's read this out. They say 34-year-old Fergus has just arrived at the hospital. So it means this could be emergency room scenario. He is concerned about soccer again. You will have 7 minutes. So this is the information, name and age of this patient, location, and what happened. Now you will have 7 minutes to complete a focused knee assessment. So now think about it, that what are the things you will be going over when you do the assessment. Definitely, you have to remember that there are 4 steps on which we do the assessment, and then you follow all those 4 steps: inspection, your palpation, your percussion, your auscultation. So just use accordingly what you have to use. For example, in knee assessment, I will not have to auscultate anything, but I'll have to do some palpations, I'll have to do some inspections, right? So what other things do you want to assess? Are you assessing their mobility? Are you assessing the level of pain? Are you assessing if there is any fracture? And if there is any, how is their reflexes, and where is this pain located? Is it radiating? So every single detail about that knee thing which this patient has, and address any of client's concerns. So definitely focused knee assessment is a skill, which is again 20% of this whole scenario. What is the rest of the 80%? Yes, Divya, we're going to do the range of motion. Thank you. Yes, so what is the rest of the 80%? The rest of the 80% is your knowledge. What is your knowledge on this? What could have happened to this patient? Your beliefs, your values, your ethical practice. So all those things come into practice. How you knock, like the moment you enter the door, your assessment starts. The moment you hand over that barcode, your assessment technically starts. And from there on, they're assessing you. They're on every action, every breath you take, you're being assessed on that. So breathe ethically. I don't know, what does that mean? Okay, so yeah. Now, please note, as you proceed with the physical examination, explain to the examiner what you're doing and describe any findings. So you are going to talk with the examiner. And I always call these exams as like a show it off thing, that whatever knowledge you have, show it off. Like, oh, I'm looking at the room for the safety. Oh, I'm going to just pick this up using good body mechanics. How about that? Extreme show off. That's what you're going to do here. So at the 7-minute mark, you will have 4 minutes to answer the examiner's questions and questions which are related to the scenario. So you have 11 minutes for this station because you took 2 minutes to read all this. Please hand 1 barcode label to the examiner. So this is how your OSCE sheet, instruction sheet will look like. Okay, then when you go in, knock, knock, You have 7 minutes from start to finish with that client, and there will be a warning announcement at 6 minutes when you should be wrapping it up. You can just come to a little conclusion, and don't panic even if you could not come to a conclusion. As I told you, they may trick you sometimes because they really want to see how ethical you are, how much considerate and compassionate you are. So at the end of the day, focus your care, focus your scenarios on your patient. Do not worry about task completion. That's an important thing, definitely. But I would worry how my patient feels. I would be very compassionate, empathetic to my patient. Yes, you're remembering all the qualities of a nurse. So what are we assessing here? So we are going to do some scenarios where we are going to perform health history, physical assessment. We're going to do some scenarios with implementation of stuff. So they may ask us to do some procedures, maybe a dressing, again, yeah, some injections and stuff. And they also see how are we communicating. Oh, I'm freaking out. I have a lot of pain. I understand. You have so much of pain. Would you like to talk more about this? That one sentence and they're dead. Okay, perfect. Good job. Then your responsibility and definitely your collaboration. Am I aware that if this happens, who should be contacted? Because all I know is there is a doctor in the hospital, but in Canada, we have tons and tons of people who are handy and resourceful, and we need to know who to call when, and that's what they're looking for. Bingo. So once you're done with your client encounter, your 7 minutes are done. Yeah, so this is what I actually prepared because I wanted to tell you guys that this is so important, that treat your patients as you would do with a real client in the clinical settings. Like, don't think you're in a fake world. That's an ideal world for you. So just do exactly the same thing, except panicking out and being the real nurses who always assess. So always assess first. Then whatever you're doing, you talk it through, just like I said. So it is a sophisticated statement for just showing it off. Then demonstrate clinical ability in a natural and focused and professional manner. So you know what I mean? Yeah, we talked a lot about this. Yeah. So once your clinical encounter is over after 7 minutes, when you got a 6-minute announcement and stuff, then examiner will start asking you questions, and you have 4 minutes for those questions, and there can be up to 4 questions. So you can say that you have about a minute to answer each question. And those questions are all about the case scenario you were just in. They will be about analysis and interpretations of findings, that, oh, why do you think is potassium so important if someone's getting digoxin? Then your nursing care plan, what is the first thing you would do if this happens? What is the first thing you would do if that happens? So you know you always start with assessment. Prioritization is the same thing. Then your patients, then how do you evaluate? How do you document? How do you monitor them for as plan of your care? What is your collaboration with other health team, ethical safety? How do you advocate for your patients? If anyone needs something like a pain pill and they're not prescribed with that, then do you take pain to actually call the physician and get pain medication? And the similar question which we did about social worker and the nurse conflict about discharge. So are you able to advocate what your patient needs are? And then legal obligations like having a consent, giving them the right medication, right times, all these things. Are you able to answer all those questions? So the good thing is that if it's a knee assessment scenario, your questions will be revolving around assessment and knee. They will not go to brain, so they'll just stay in the knee. So that's the good point about this question answer at the end. All right, so after this whole thing, we're done with like what is OSCE, what are the components of OSCE. Now, and we also talked about all the competencies which you need to know and how you need to know. Now, how to study for this? The question still remains active in anyone's head. So you told us so many things, like what to study, maybe more than how to study. The right question is like what to study. So this is my personal recommendation, and this is what we do with our students in our review place. So we go through with them through the participant guide. We want everyone to have an idea about what the exam is. So this is what I take about like 30 minutes in the beginning of my sessions to talk about what the exam is. The same thing I do with all my other exams like Salbin or NCLEX, CPNRE. Like I would tell them what are they getting into basically. Then we also want them to be aware of all the entry-level competencies. So for example, here I was running through and I was superficially telling you. So I would talk more in depth and in detail in my classes about these competencies. And then we go in detail, like if this is your competency, how do you meet it? If this is your competency, how do you meet it? So we play scenarios around those competencies, and that's what you want to do. And then this is very important. You need to know the Canadian healthcare system. This is like how it functions. And trust me, like until I actually like started working in the hospital, maybe as a student nurse or as a registered nurse, until then I had no idea technically. I studied a lot, I read a lot, but you don't know until you do it. So that's what I try to do. I bring the real life experience in front of people, that okay, this is how it works in the hospital. This is what I want you to kind of like know about the hospital, the system, that if you were in the hospital, this is what you're going to do. If you were in the doctor's clinic, this is what you're going to do. If you're in public health, this is what you're going to do. Community health, this is it. So that's very important, like know how the system works in Canada. And then basics of your nursing knowledge, like I'm sure this is something which I don't have to tell you, you all have been reviewing them. And practice your multiple choice questions if you have any, and we do like loads of multiple choice practice questions in the class, and we divide those questions on the basis of competencies, so that our students understand that what kind of things are they going to get into. And then practice the entry-level nursing skills for sure. That's the most important thing, definitely, but just 20% important technically. And then you can always create a study group, and I always encourage my students to do that. Even people who have been into my Selbin classes know that I am a big fan of self-study. So after I review with them, I always ask them that if you can just partner up with at least like one person of your choice, and let me know if you're comfortable. Because when you practice, and this always happens, like when the girls, they practice with each other, I would see my phone loaded with text messages. Oh, we didn't get this, we didn't get that. And then actually the real critical thinking evolves. If you're studying by your own self, it may not be as effective for this exam. Like I would study by my own self for exams like NCLEX and stuff, but for this exam where you need someone to be with you, so have someone around you who is going to write their exam soon, maybe around the same time. It helps. So that's very important, guys. And yeah, then so if you would like our assistance, so I would like to tell you guys what actually we do. So here at PS Learning, you have seen now like what is my take on this exam. It's not just giving you cardiovascular system and respiratory system and this system and that system and then asking you to do some questions. We know that this exam is very crucial for you. We know that you can only take it once. It's once in a lifetime opportunity. So I know that it has to be done very well. So we are experts, like we train you for this. We train our students for this. So I don't want to sound that I'm alluring you into, but no, we train our students very well for this one. And so we have a 3-day program if anyone is ever interested. So in this 3-day program, we dedicate to all just those topics which we think are on the exam. We do not talk about anything else. Like I know that you will not get any pituitary gland cancer questions, so why would I teach you that? So we just focus on Canadian healthcare diseases. And we do extensive review, again, based on competencies, because I'm a big fan of competencies. By now, you know that as well. And we do practice the MCQs, which we have typically created for IENCAP and ARNAP. And then definitely we do scenario practices in every variety of patient settings. And our course is online for this one, and all our focus is to meet the competencies, because in us, our IENCAP and RNAP, there are not major skills they're testing you on. So it's basically just talking. So that's why we have this online program, specially designed 3-day program for the IENCAP and RNAP OSCEs. So yeah, thank you for attending this one. Now I would like to open you guys for the Q&As. So if